Hazmat teams moved in before the sun came up in Dallas with word that a second healthcare worker has tested positive for Ebola.
No one wants to get this right more than our hospital, the first to diagnose and treat this insidious disease that's now attacked two of our own.
Officials will not release the name of the patient, but do say she was a part of the medical team that included critical care nurse Nina Pham, who was also infected, treating Ebola patient Thomas Eric Duncan, who died as a result of the virus. The women are part of a group of 77 healthcare specialists who had contact with Duncan, were identified by the Centers for Disease Control, and are being monitored right now.
We are preparing contingencies for more, and that is a very real possibility.
In a conference call last night, union officials read statements they said were from anonymous nurses who treated Duncan.
Were the protocols breached? The nurses say there were no protocols.
Nurses said Duncan had contact with at least 7 patients in the hospital, that initially they were not given full protective gear, that they had only optional training on Ebola, and that staff moved in and out of the isolation unit without being decontaminated.
We're looking at every element of our personal protective equipment and infection control inside the hospitals. We don't have an answer for this right now, but we're looking at every possible angle around this.
Dangerous, potentially deadly angles that seem to be shifting almost daily. Jay Gray, NBC News, Dallas.